Right now on phone, I have Dr. Stella Kangethe, who's all the way from Muranga, who'll share with us definitely experience ya huko kwa grau, how things are right now. Hello.
Hello.
Hi, Stella.
Hi, how are you?
I'm very, very fine. Karibu sana Vibes Radio.
Asante.
Muranga inakupelekaje leo asubuhi?
Muranga iko sawa. Tunaendelea na kazi.
Well, okay, based on what President Uhuru Kenyatta stated on Monday, do you think Kenyans are actually ready to go back to church?
It depends on you. As he said, you are supposed to, kazi imerudi kwako. It is an individual decision that you have to take.
Yes.
Do you want to go to church? Will you be careful when you go to church? Si tumepatiwa hiyo 100 people maximum.
Yes.
Ukiangalia, the 100 people were also given an age bracket between less than 13, you can't go, more than 54.
Yes, 58.
So, 58,
yes.
sorry.
Yes.
So, please, if you are not in that age bracket, usidanganye. Si hawataenda kuangalia ID.
Okay.
Please, it's bad.
Okay, and how are things, especially in Muranga County? How are people, let's say, responding to the restrictions the government is giving in terms of even social distancing? How is it tuko kwa ground?
Kwa ground inaweza kuwa different, but we are taking everyone, as if you come to Muranga, in front of every shop there is a tap, there's soap. In the hospital, we are managing people. As you're coming in the hospital, there is something we call triaging. Triaging ni pali ukiingia hospitali, you will check, do you have symptoms of COVID? If you don't have symptoms, then you can proceed.
Okay.
So that happens. If you have symptoms of COVID, then you're put in something we call the holding area, and then maybe you're tested after that. Okay.
And other than that?
Other than that, then after testing but as everything is happening, we are still making sure that kama ulikuja na hypertension, kama ulikuja na other things, we are still managing that in hospital.
Okay, so if let's say if I have a flu, is it advisable for me to come to the hospital to get tested? Because there's so many people right now, when you are naogopa wanasema, nikaenda hospitali, chances are very high that I might get exposed to this disease.
Okay, sawa. If you have a flu, how serious is your flu? Tuanze hapo. Sawa. Because there's usually the common cold. Ukikunywa, if it is not responding, kuna wale wanakunywa ndimu, unakunywa turmeric, inaendanga normally.
Yes.
In a normal day. If that does not happen, tafadhali kuja hospitali tukuangalie. Kwa sababu what we have realized ni watu wanaogopa kutestiwa because wanaona they are seeing like people are being mistreated wakikujiwa.
Ndio.
We need to stop that. We need to stop that stigma. Na hata ukipona si umepona.
Ndio, for sure.
Tutarudi alafu stop like the big thing ni stigmatization tuko nayo. Kuja, we treat you, we don't want people to die, we don't want you to stay at home. Na uko na shida zingine and we can manage that.
Right now, especially since schools wamesema zitafunguliwa officially next year, do you feel, especially now children being at home, because right now wanaboeka kukaa kwa nyumba, is there a way that, let's say, chances are very high, they might be also the source of COVID? Because nachikisa hizi wanaranda wakichapa malaps na watoto wa jirani. So do you feel that they might also be kind of be the cause of this disease kuspread sana huko lese kwa ground?
Okay. I will not say yes to that because it has been shown that asymptomatic people are not spreading the disease. Okay. You remember WHO, I think that was last week?
Yes.
Walisema the symptoms are not spread as much by asymptomatic people, but we hold that with 50-50.
Yes.
So I will not say yes to that, but I will say, tafadhali, just take care of yourself.
And what's your message to all the okay, our listeners, MVPs, what's your message to our listeners, especially for someone who's in the front line? Because you see, you are the one who's interacting with patients. You're the one who's seeing cases increase. You're the one who's literally qua ground seeing how you guys are tackling the disease. What's your message to people?
Please be careful.
Okay.
Our health structure in Kenya was not that good, but we are trying to get there. Pole pole. Muranga uliona, we recently built an ICU.
Yes.
Big up. So we are really trying to get to a point that our health system everywhere in Kenya is getting better. So please take care of yourself. If you unaona restrictions zimefunguliwa.
Ndio.
If you really don't have to go visit your grandmother, tafadhali usiende. Kwa sababu, wewe unaishi Nairobi, wewe unaishi Mombasa, wewe unaishi kwa high risk zone, you might be asymptomatic, lakini unaona you don't have any other diseases ongoing.
Yes,
Sindio?
yes.
Shosho, akona pressure, akona heart problem, akona lung problem. Ukimpelekea, unajua utaanza kumhug, utamsalimia, utamwachia COVID.
Ndio, ni ngumu
It will affect exactly. Una imagine shosho akikupatia kitu na ukatae kuchukua. It looks like an abomination, you know.
For sure.
So tafadhali, if you don't have to go to Ushago, please don't go.
And for those who are are planning to travel, let's say, cause kama uko huku Nairobi and umesikia venye rent mazee umeshindwa kulipa and you feel that you have a business that you want to start, let's say in Muranga, how can I prepare myself to come to Muranga? And I know, let's say, mi najua I can social distance, but how can I prepare myself?
You can prepare yourself in many ways. Number one, if you can, kuna many means of transport, right? So just make sure sanitizer iko kwa mfuko. Ukienda kwa gari, usiingie gari iko na watu wengi.
Okay.
Nona, there's usually the travel restrictions.
Yes.
But my take is, do you really have to come?
Okay.
You know?
Yes.
Yes.
Sasa, thank you so much, Dr. Stella Kangethe, and may you please take care, especially huko kwa ground maze.
Sawa, jichungeni, wear mask. Please be safe, social distance.
Sawa, asante sana Dr. Stella Kangethe. Umesikia? Jichungeni, wear mask, and kama how need to travel, kaa kwa nyumba. Kama una feel things are getting tricky, especially kama you're based in Nairobi and you feel you have an urge to go all the way to Shags, make sure that uko na sanitizer. Make sure umepanda ma3 haijaja, and always remember, wear your masks correctly. Here's Don't Come Back by Taras Riley.
Vibes Radio, we rule the nation in this generation.